So, hi, Dr. Childers and Dr. Dangulik. This is Mary Tree speaking, and I'm here to present my plant change project. So, my preceptor for this project was Professor Lau, who is the director of the FNP program here at CDU. And the issue that we chose to address in our facility was the FNP preceptor shortage. So, specifically, I'm going to be talking about how our intervention, which is the clinical educator training program for FNP preceptors, kind of affects recruitment and retention. So here's a table of contents. I'm just kind of walk through how I identified the issue myself, why we chose our intervention, and the process by which we would kind of put the intervention into action. So the model of change that I've chosen for this project is the Lewin's model of change theory. So Lewin's model of change theory consists of 3 stages: the unfreezing stage, for which you identify and communicate the need for change within your organization, and then kind of facilitate a culture of the need for change. So during the stage of my project, I was speaking to a lot of the individuals involved in the preceptor recruitment and retention process, which was mainly the FNP director and the FNP clinical coordinator. During these talks, we kind of covered what the current process was for recruiting and retaining preceptors and how that was kind of working out in the present stage. So what we found was that a lot of our preceptors were mostly coming from personal connections, usually clinicians that students knew, and they were just kind of precepting them like as a personal favor. And while most students were able to secure preceptors this way, we found that 8 out of 72 students still hadn't started their preceptorship well into the semester that this project was taking place. And additionally, the FNP director was receiving a lot of phone calls, emails, communications from preceptors, just kind of expressing their frustration and confusion regarding expectations, responsibilities, and just kind of not knowing what the preceptor role consists of primarily. And then, of course, I did a more thorough literature review just to kind of examine what most of the evidence is saying are barriers and solutions to the preceptor shortage. Ultimately, we kind of defined a need for us to offer training to our preceptors, not only to lessen frustrations of precepting, but also to motivate those clinicians who kind of are a little hesitant to take on the preceptor role, to say that, yes, we will provide you guidance if you show that you're willing to precept with us. So the next stage is the change stage, where you would implement and kind of reevaluate the process and as you kind of integrate it into the organization. So due to time constraints, we weren't really able to implement the plan change within the organization, but hypothetically, this is the stage where we would meet with all the staff involved and kind of go over our implementation and evaluation plans and what roles and responsibilities they would kind of play in those parts. So lastly, we have the refreezing stage, which is where hopefully our clinical educator training program becomes kind of a accepted standard in our onboarding process for new preceptors. So moving on, we have the significance of the problem, which is why is the preceptor shortage so significant, and why is lack of training contributing to it? So as we can see here in figure 1, the US is experiencing a shortage of primary care physicians that will only grow like over the next few years. And this is a major issue because, as we know, primary care is not responsible like not only for prevention, but also for the rehabilitation of several chronic illnesses such as diabetes and heart disease, which are so prevalent in today's society. So what can we do to kind of help prevent this primary care shortage? In figure 2, we can see here that family nurse practitioners were found to have similar patient health outcomes as those under the care of primary care physicians. And this study was done in states where FNPs were given full practice authority, which demonstrates that FNPs do have the capacity to help fill primary care provider gaps that were left by the worsening physician shortage. Okay, but as we can see here, the rate in which new FNPs are kind of being introduced into the workforce is being significantly limited by the availability, or should I say unavailability, of clinical preceptors. So in figure 3, we can kind of see that nursing programs at all levels, whether it be undergrad, MSN, or doctorate, are they're limiting the number of students that they can take because of the lack of clinical placements available. And, recent figures from the American Association of College of Nurses have even shown that 57% of NP programs had to decline qualified applicants due to insufficient preceptor placements. because of course, without preceptors, they cannot fulfill the clinical hours needed to make them eligible for licensing. So what is contributing to these lack of preceptors? So in figure 4, we can kind of see that most of the common barriers to precepting were related to negative perceptions of precepting. Those being, feeling that there's not enough time to precept students, that having a student can decrease productivity, and that just having a student will cause the preceptor to feel overwhelmed overall. So in other words, the shortage of preceptors is not a question of if there are enough clinicians to take on the role, but rather if the clinicians are willing to take on the role. And we can kind of see that there is an unclear path from clinician to educator. So 68.2% to 77.6% of current NP preceptors mentioned that they never received formal preceptor education or training. And with that, more than a third of NP preceptors actually reported feeling unprepared to teach. So nurse practitioner preceptors, they're most of the time clinicians with no prior experience or background in being educators themselves. Yet when they take on this role of preceptor, we're kind of expecting them to be educators, evaluate, teach, provide feedback to students. And so the lack of resources available to help these clinicians successfully transition to those clinical educator roles can lead to frustration and lead to a lot more time thinking about how I'm going to be doing these things rather than doing the things themselves. And a lot of these lack of resources is because there are no requirements for FNP programs to provide preceptors with clinical educator training, nor are there really any standardized programs in place for preceptor development. So my EBP question for this project is, in a master's level FNP program offered through an LA-based university's College of Nursing, does providing prospective preceptors with formal preceptorship orientation and clinical educator training sessions, as compared to no training, which is the current practice, improve preceptor recruitment and retention over the span of 1 year? Okay, and let's go through our review literature. So the review literature took place mostly throughout the month of July, and it was conducted just to kind of determine certain topics such as the scope of FNP preceptor preparation, which is just kind of to get a gauge of how a majority of preceptors, how prepared they feel to take on their role as preceptors. And then current preceptor development strategies, such as what resources and training are being offered currently, as well as resource modalities available for training. And so these are the databases I use: PubMed, CINAHL, ProQuest. And for inclusion criteria, I wanted to keep it within the US, just to keep it within our licensing requirements. And then I wanted it published after 2017, just to take into account technological advances for training that may have only recently come up, smart apps and all that. And I wanted the population to be NP preceptor specific, so only MDs, DOs, PAs, APRNs. I didn't want to include, pharmacy preceptors or undergrad RN preceptors. And then, a lot of the keywords were pertaining to NP development, recruitment, support. And then after the initial search of articles and narrowing with inclusion criteria, I narrowed it down to about 7 articles to help develop the framework for my plan change project. Okay, so here are the 7 articles that I narrowed it down to. As you can see, most of them kind of utilize the pre-test, post-test with a single group design, which is what I later incorporated into my evaluation plan to determine the effectiveness of my training as well. Okay, and here's some shared characteristics between the articles. Most of the samples were, as I mentioned, NP preceptors based in the US. The interventions all involved preceptor training, but through different modalities. There were in-person lectures, online modules, some integrated both, and then all of them kind of used a needs survey to determine whether the training helped kind of erase the barriers for precepting. And then the dependent variables that they measured were all, related to preceptor competency, willingness to precept, and the usefulness of the training as determined by the preceptors. And they kind of measured these variables using, as I mentioned, the pre and post-test results to measure their growth and knowledge, ordinal surveys, just kind of ranking the kind of incentives that help them move their willingness to precept, as well as open response surveys for them to provide feedback on what worked and what didn't work during the trainings. Okay, and then here are the key findings of the articles themselves. So overall, the implementation of preceptor training led to a decreased burden of clinical teaching. And this was done by increasing knowledge of how to precept, improve self-efficacy, and then like just making them feel prepared for the role in general, which all in all led to a higher willingness to precept. And then in terms of learning modalities, we kind of found value in both the in-person, which allowed for more communication and like simulated application of the teaching methods, as well as the online modality, which took into account time restraints, workloads. People don't have time to be doing training all the time. So then in terms of the topics that we covered during the training, most of them mentioned they wanted to learn clinical teaching frameworks such as the RHYME, the 1-minute preceptor model, the triangle method of feedback. And as well, they also want to learn how to navigate through conflicts in the clinical education setting, as well as time management. Okay, so then the best training program design that we decided to go through was not in person, not online, but a combination of both that balances time commitment and communication benefits. Okay, so here's our policy and protocol. So this will be for new preceptor affiliates starting this January. And as you can see, the training requirements differ for new preceptors, depending on whether or not they've had prior precepting experience. So for new preceptors with less than a year of precepting experience, we want them to complete online learning modules. Well, actually, just across the board, we want them all to complete online learning modules because this will provide the foundation for the clinical teaching methods and how to be effective preceptors. Only those with less than a year of experience are required to complete the synchronous learning session via Zoom, just because they haven't had much experience yet in the educator role in a clinical setting. So with the simulations and demonstrations, we want them to kind of get used to being in that role and kind of practice being an educator in that setting. Okay, and then upon completion of the training program, the preceptors are eligible to receive continuing education units, which we find is kind of an incentive for them to finish the training as well. Okay, and this is kind of an outline of what the online learning modules cover, when we want them to finish things, and as well as what the synchronous Zoom learning sessions will cover. So as we mentioned, a lot of simulation practices for clinical teaching and navigating conflicts, as well as, just more communication with the lead faculty to promote that support system while you're precepting. Okay, and then here's our implementation plan. So in the implementation plan, we've broken it down to kind of like 4 stages. The first stage being kind of introducing the plan, not only to the staff, but also to the preceptors themselves. We want to disseminate that we have a training program available to you if you are interested. So we want to spread that word, through electronic alumni communications, FNP program website, or through our clinical partner facilities. And then we kind of want to introduce this plan over the span of 1 year to kind of observe its impact on recruitment, preceptorship, and retention for the fall 2024 semester specifically. Okay, and then once we've kind of gathered our prospective preceptors that are interested and want to get involved in the training, we'll have our pre-training phase implementation, which is mostly the clinical coordination team, who will be kind of providing the detailed instructions and expectations for the preceptor training tasks together with their onboarding packets, as well as, like deadlines for completion, how to register for the synchronous learning session, and as well as a kind of preceptor pre-survey before the training, just to kind of determine like a baseline of where they are. So in the training phase, which is part 3, this is where the clinical coordination team is more responsible for maintaining adherence of the preceptors to the training program. And this will be done through like weekly reminders to complete any unfinished training tasks. And then the FNP director and lead faculty will be in charge of conducting the synchronous learning sessions and kind of engaging the preceptors in that relationship with the school. So then part 4 is the post-training phase, where the clinical coordination team is just kind of going to follow up with the preceptors to determine, here's a survey of the training. How well did your knowledge improve? And then after the preceptorship, how well did the training actually prepare you for what preceptorship entailed? Okay, and then lastly, we have our evaluation plan. We mentioned that our primary outcomes we want to monitor are preceptor recruitment and retention. And we want to kind of monitor recruitment with the pre-training survey, asking the preceptors whether having the option of training kind of increased their willingness to precept. And then retention with the follow-up survey, kind of determining whether the training actually had an impact on preparing them enough that they would want to precept again. Like it's such an enjoyable experience. And then secondary outcomes is, measuring whether the training surveys actually had an impact on increasing role preparedness in the preceptors themselves. So we had the pre-post training surveys, which assessed, kind of the baseline of the preceptor knowledge and confidence in clinical teaching. And then we had the follow-up survey after preceptorship, which, as we mentioned, kind of determined whether the methods that we taught were useful during the preceptorship themselves. And then here we have all the resources. Thank you.